Reduce the risk of stroke. A stroke is potentially one of the most devastating and disabling conditions a patient can have. Nearly 700,000 of them occur in the United States each year, making it the leading cause of disability and the fourth leading cause of death in adults. In this video, I would like to tell you about what you can do to reduce your risk of having a stroke. While there are several risk factors that you cannot control, like age, being an African American, physiological abnormality in brain, etc., there are several that you can control, and I would share 7 tips to help you reduce your risk of stroke. 1. Control your blood pressure. There is a reason hypertension is called the silent killer. You don't feel it. It doesn't cause any obvious symptoms. It doesn't cause pain or discomfort. But it eats away at inside of the walls of your arteries, and it can lead to problems with blood flow to many different organs of your body, the most sensitive of which are the heart and the brain. This is why hypertension is considered a major risk factor for both heart attack and stroke. The best way to treat this is to see your doctor, have your blood pressure measured, and identify whether it is in the safe range or not. And some cases of hypertension might be treated with diet and exercise. Many require medications. And you will have to take these medications religiously for the rest of your life. You can't stop taking these medications just because you feel good, because again, that hypertension is silent. To control your cholesterol. Like high blood pressure, This is something you won't be notice that builds up in your blood system based on how your body metabolizes certain nutrients. Some of us can control our cholesterol with diet and exercise, but in many cases your body's ability may not metabolize cholesterol as well as someone else's. You may require medications. Talk to your doctor about whether your cholesterol is in the safe range, and if not, what medications might help you to keep it under control. Three. Control of diabetes. A third way to reduce your risk having a stroke is to control diabetes. Diabetes is less common but very dangerous condition that can cause damage to the walls of the blood vessels that feeding the blood flow to your brain and heart and other organs. Diabetic patients clearly have a higher risk of having a stroke. And controlling diabetes may reduce the damage to those blood vessels and reduce your risk of having a stroke significantly. In addition to controlling high blood pressure, high blood cholesterol and diabetes, there are other lifestyle changes that might help reduce your risk of stroke. The fourth step is to avoid smoking. Four. Quit smoking. You have heard a million of times that smoking is bad for you. No doubt about it. In addition to increasing your risk for numerous types of cancer, smoking is a significant risk factor for both heart attack and stroke. and quitting or avoiding smoking is one of the best things you can do for your overall health. Five. Maintaining an ideal body weight. Obesity is well recognized risk factor for numerous disease processes including stroke, and maintain a good body weight reduce your risk of stroke. Talk to your physician about a heart-healthy diet that will help you to do so. Six. Regular exercise. Regular physical exertion on a daily basis, at least 20 minutes, has numerous health benefits. Among them including your risk of stroke, so get out and walk, get some exercise, play a game, but be active. 7. To be aware of a condition called atrial fibrillation. This is an irregular heartbeat that causes one of the chambers of the heart, the atrium, to beat in an irregular fashion. The result is that the blood flowing through this chamber does so in an irregular way in a slow fashion and may form blood clots on the inside wall of the heart. These blood clots, if they break free, can go through the arteries that feed the brain, plug them, and result in a stroke. Understand signs and symptoms of stroke.